The gunman entered St. Mary's Hospital emergency room at 11:47 p.m. with a semi-automatic rifle, immediately shooting 2 security guards and taking 17 patients and medical staff hostage. ER nurse Sarah Johnson watched the chaos unfold with the tactical awareness of someone who'd coordinated medical responses during combat operations, because she'd spent 12 years as an Air Force pararescue medic, extracting wounded personnel from hostile environments that made this hospital shooting look survivable. Bang, bang, bang. 3 shots echoed through the emergency department. Blood splattered across the triage desk. Patients screamed. Medical staff dove for cover behind gurneys and medical equipment. The smell of gunpowder mixed with antiseptic as St. Mary's Hospital transformed from a place of healing into an active combat zone. "Everybody on the ground. Nobody moves or I start executing people." The gunman's voice cut through the chaos like a knife. Sarah Johnson was starting an IV on a cardiac patient when the shooting began. Her Air Force Pararescue training kicked in instantly. Hostile situation assessment, casualty evaluation, tactical medical response. But she was wearing scrubs instead of combat gear, surrounded by terrified civilians instead of trained soldiers, and facing an active shooter who had just turned her workplace into the kind of battlefield she'd spent 6 years trying to forget. Welcome to Secret Human Stories. Before I tell you this incredible story of hidden military rescue expertise and tactical medical response that prevented a hospital massacre, tell me in the comments what city and country you're watching from. And if you want to see more stories about heroes hiding in plain sight, hit that subscribe button right now. Because sometimes the most skilled combat medics are saving lives in civilian hospitals, waiting for the moment when their battlefield training can protect innocent people from those who want to harm them. 11:47 p.m., St. Mary's Hospital, Detroit, Michigan. The night shift was typically busy. Car accidents, heart attacks, overdoses, and the usual medical emergencies that kept urban emergency rooms running at capacity. ER nurse Sarah Johnson had been working the trauma bay for 6 years, and she'd seen every kind of medical crisis that civilian emergency medicine could present. But she'd never seen anything that matched the combat zones where she'd spent 12 years of her life before becoming a nurse. The gunman, Marcus Webb, a 34-year-old man whose wife had died in this same emergency room 3 weeks earlier due to what he believed was medical malpractice, had entered through the ambulance bay with a stolen AR-15 rifle and 200 rounds of ammunition. His plan was simple: kill as many medical personnel as possible, then turn the gun on himself. Marcus had already shot security guards Jim Rodriguez and Lisa Chen at point-blank range. Both were down, bleeding heavily, and would die within minutes without immediate medical intervention. But Marcus was standing over them with his rifle, daring anyone to try to help. "You people killed my wife!" Marcus screamed at the terrified medical staff. "Now you're gonna pay!" Sarah assessed the tactical situation with the kind of military precision that her civilian colleagues couldn't understand. Active shooter, 1 male, automatic weapon, high-capacity ammunition, emotional instability indicating unpredictable behavior patterns. Hostages, 17 total including patients and staff. Casualties, 2 security guards with life-threatening injuries requiring immediate medical intervention. Time until police tactical response, estimated 8 to 12 minutes. The wounded security guards would be dead in 4 minutes. But here's what made this hospital crisis even more impossible. Sarah recognized the tactical pattern of Marcus's positioning and movement. He wasn't just an angry civilian with a gun. His stance, his weapon handling, and his systematic coverage of exits indicated military or law enforcement training that made him far more dangerous than a typical active shooter. Sarah's Air Force pararescue background told her something that would terrify anyone who understood tactical operations. Marcus Webb knew what he was doing, and his plan was more sophisticated than random violence. Staff Sergeant Sarah Johnson had served 12 years with the Air Force's 58th Rescue Squadron, specializing in personnel recovery operations and combat medical response in Iraq, Afghanistan, and other classified locations from 2008 to 2020. For 12 years, she'd been a guardian angel, a pararescue jumper, whose mission was extracting wounded personnel from hostile environments where conventional medical evacuation was impossible.
Her military record included 156 combat rescue operations, 234 successful personnel extractions, and a reputation among special operations forces as someone who could reach wounded soldiers in situations that other rescue teams couldn't handle. She'd earned the Air Force Cross, 4 Bronze Stars with Combat V, and the Pararescue Badge that identified her as one of fewer than 500 active Air Force personnel qualified for the most dangerous rescue operations. But Sarah's specialty hadn't been routine personnel recovery. Her unique expertise was what pararescue teams call hostile environment medical operations, providing advanced trauma care while under enemy fire, coordinating medical evacuations in active combat zones, and treating wounded personnel while simultaneously conducting tactical operations against hostile forces. Now, 6 years after leaving the Air Force, Sarah was watching a situation that combined every skill she learned during 12 years of combat rescue operations: tactical assessment of hostile threats, emergency medical treatment under fire, coordination of civilian evacuation, and the leadership necessary to organize untrained personnel during life-threatening emergencies. Sarah made the decision that either save everyone in the emergency room or get them all killed. Moving with practiced stealth, Sarah began organizing a tactical medical response that utilized her military training while appearing to be normal civilian behavior during a hostage situation. "Dr. Martinez," Sarah whispered to the emergency physician crouched behind a medical cart near her position, "I need you to listen carefully and do exactly what I tell you." Dr. Elena Martinez looked at Sarah with confusion. "Sarah, we need to wait for police. This man is armed and dangerous." "Doctor, I'm Staff Sergeant Sarah Johnson, Air Force Pararescue, retired. I specialize in tactical medical operations under hostile conditions. I'm going to save those security guards and neutralize this threat, but I need your help coordinating medical response." The transformation in Sarah's demeanor was immediate and unmistakable. The compassionate nurse disappeared, replaced by someone speaking with the calm authority of someone who'd coordinated life-or-death operations under combat conditions. Dr. Martinez had worked emergency medicine for 15 years, but she'd never heard the kind of tactical confidence that Sarah was displaying. "Sarah, what are you talking about?" "Ma'am, I've conducted 156 combat rescue operations in hostile environments. This gunman has military training, he's positioned to control all exits, and he's going to start executing hostages within the next 3 minutes. We can either wait for police and watch people die, or we can use my tactical training to end this situation." Sarah began implementing a plan that combined her Air Force pararescue training with her knowledge of the hospital's layout and medical resources. The plan required precise timing, coordination with untrained civilians, and the kind of tactical risk assessment that she'd use to save wounded soldiers in combat zones. First, Sarah needed to treat the wounded security guards without alerting Marcus to her movement. Using medical equipment as cover and her knowledge of tactical stealth, Sarah began moving toward the casualties while maintaining the appearance of a terrified nurse hiding from the gunman. Her movement was so subtle that Marcus didn't notice as Sarah reached the position where Jim Rodriguez was bleeding out from a chest wound that had punctured his lung and created the kind of trauma that required immediate surgical intervention. Using medical supplies from the trauma bay and techniques learned during combat medicine training, Sarah began treating Jim's injuries while remaining concealed from Marcus's line of sight. Her hands moved with the precision of someone who'd performed similar procedures under enemy fire, but now she was saving a security guard instead of a wounded airman. The treatment had to be silent, efficient, and effective enough to stabilize Jim until the tactical situation could be resolved. Sarah used chest seals, hemostatic agents, and airway management techniques that kept Jim alive while she prepared for the most dangerous phase of her plan. But here's what Sarah realized that would change everything about her tactical approach. Marcus Webb wasn't just seeking revenge for his wife's death. He was conducting a planned assault designed to cause maximum casualties before police could respond.
His positioning, timing, and equipment indicated coordination with tactical knowledge that suggested he wasn't acting alone. If you're already amazed by what you're hearing, make sure to hit that subscribe button because this story is about to get even more intense. Through her tactical observation, Sarah identified patterns in Marcus's behavior that indicated he was communicating with someone outside the hospital using a concealed radio device. His movements and timing suggested he was following a predetermined plan that included contingencies for police response and tactical countermeasures. This wasn't a lone gunman crisis. This was the beginning of a coordinated attack on the hospital that would involve multiple shooters and possibly explosive devices designed to cause mass casualties when emergency responders arrived. Sarah's military intelligence training told her they had maybe 2 minutes before the situation escalated from a single active shooter to a multi-phase terrorist attack that would overwhelm any conventional emergency response. Sarah activated protocols she hadn't used since her Air Force service. Using her cell phone, she sent a tactical assessment to Detroit Police Department's emergency dispatcher using military terminology that would immediately identify her as someone with advanced tactical training. This is Staff Sergeant Sarah Johnson, Air Force Pararescue, retired, reporting from inside St. Mary's Hospital active shooter situation. Hostile appears to have military training and external coordination. Recommend tactical response team deployment and explosive device sweep. I am providing medical treatment to casualties and preparing to engage hostile if necessary. The message reached Detroit Police Lieutenant Colonel James Morrison, a former Army Ranger, who immediately recognized the significance of having a trained military operator inside the crisis zone. Sergeant Johnson, this is Lieutenant Colonel Morrison. What's your tactical assessment? Sir, single hostile with automatic weapon has secured ER and is demonstrating tactical positioning consistent with military training. Suspect appears to be coordinating with external parties. I've treated 2 casualties and am prepared to engage using close-quarter combat techniques if situation deteriorates.
Sergeant Johnson, maintain position and provide intelligence. Tactical team is 7 minutes out. Do not engage unless absolutely necessary to prevent imminent casualties. But Sarah's tactical situation was about to change in a way that would force her to use lethal skills she'd hoped never to employ in civilian life. Marcus had become suspicious of the medical activity around the wounded security guards. His military training told him someone was providing medical treatment without his permission, and his paranoia was escalating toward violence that would result in the execution of hostages. "Who's moving around back there?" Marcus screamed, swinging his rifle toward the area where Sarah was treating Jim Rodriguez. "I said nobody moves or I start killing people." Marcus began walking towards Sarah's position with the rifle raised, his finger on the trigger, ready to shoot the first person he found providing unauthorized medical care. In 30 seconds, he would discover Sarah treating the wounded guard, and his reaction would be to open fire on everyone in the area. Sarah faced the decision every combat veteran dreads: use lethal force in a civilian environment to protect innocent lives, or allow multiple people to be executed when she had the training to prevent it. Sarah's close-quarters combat training from Air Force Pararescue took over. As Marcus approached her position, she used the hospital's medical equipment and her knowledge of tactical movement to position herself for a disabling attack that would neutralize the threat without killing Marcus if possible. When Marcus rounded the medical cart and found Sarah treating Jim Rodriguez, his rifle was already swinging toward her. Sarah's reaction time was faster than his ability to aim and fire. Using hand-to-hand combat techniques learned during pararescue training, Sarah disarmed Marcus with a combination of movements that broke his grip on the rifle, disabled his ability to resist, and rendered him unconscious in under 4 seconds. The entire engagement was over before most of the hostages realized it had begun. "Hostile down, medical assistance needed," Sarah called out, with the kind of professional medical authority that immediately organized the chaos into effective emergency response. Dr. Martinez and the other medical staff emerged from cover to find Sarah standing over the unconscious gunman, while simultaneously continuing medical treatment on the wounded security guard. The combination of tactical proficiency and medical expertise was unlike anything they'd ever witnessed. "Sarah, what just happened?" Dr. Martinez asked in amazement. "Ma'am, I neutralized the hostile threat and stabilized the casualties. We need to continue medical treatment and prepare for police tactical team arrival." When Detroit Police SWAT arrived 4 minutes later, they found a secured scene with professional tactical coordination that exceeded their expectations for civilian crisis management. SWAT Commander Captain Lisa Rodriguez immediately recognized that someone with advanced military training had resolved the situation. "Who secured this scene?" "That would be me," Sarah replied, still wearing her scrubs but clearly having transitioned into full tactical operator mode.
Staff Sergeant Sarah Johnson, Air Force Pararescue, retired. Hostile neutralized, 2 casualties stabilized, scene secure for medical evacuation. Captain Rodriguez examined the tactical efficiency of the scene and the quality of medical care that had been provided. Sergeant Johnson, this is exceptional crisis management. You prevented what could have been a mass casualty situation. But here's the twist that would reveal the true scope of what Sarah had prevented. The investigation of Marcus Webb's equipment and communications would uncover a coordinated terrorist plot that went far beyond a single hospital shooting. Marcus had been working with a domestic terrorist cell that planned to attack multiple hospitals simultaneously, targeting medical facilities to create maximum psychological impact and overwhelm emergency response capabilities throughout the city. Sarah's tactical intervention had prevented not just a hospital massacre, but had disrupted a coordinated terrorist attack that would have targeted 6 different medical facilities and killed hundreds of patients and medical personnel. FBI Counterterrorism Director Michael Chen later described Sarah's response. Staff Sergeant Johnson's tactical assessment and rapid intervention prevented what would have been the deadliest terrorist attack on American medical facilities in history. Her ability to recognize coordinated threat patterns and respond with appropriate practical force saved lives throughout the city. But the most important moment for Sarah came 3 days after the incident when she received a visit from Jim Rodriguez, the security guard whose life she had saved during the crisis. Sergeant Johnson, I want you to know that I'm alive because you refused to just hide and wait for help. You used your training to save me and everyone else in that emergency room. Sarah's response reflected her understanding of how her military service had evolved into civilian protection. Jim, that's what pararescue training teaches. We show up when people need saving, regardless of whether they're wearing uniforms or hospital gowns. If this story amazed you, make sure you're subscribed because we have more incredible stories coming your way. Now, for the background that made this hospital tactical response possible. Staff Sergeant Sarah Johnson had served 12 years with the United States Air Force's 58th Rescue Squadron, specializing in personnel recovery and combat medical operations from 2008 to 2020. Her military training as a pararescue jumper included advanced tactical medicine, close quarters combat, emergency response coordination, and the leadership skills necessary to conduct rescue operations under hostile conditions. Air Force pararescue training is among the most demanding in the military, combining physical conditioning that matches special operations standards with advanced medical training and tactical skills. Sarah's rescue expertise included combat medicine, tactical movement, weapons proficiency, and the ability to coordinate complex rescue operations while under enemy fire and extreme pressure. The psychological demands of combat rescue were extraordinary. Every person Sarah saved represented someone whose survival depended entirely on her tactical skills, medical knowledge, and ability to perform complex operations while under hostile fire and extreme pressure. Sarah's transition out of military service in 2020 had been challenging. PTSD from combat operations, the difficulty of finding civilian work that utilized her tactical and medical skills without triggering combat-related stress responses, and the adjustment to peacetime medicine after years of combat rescue had led her to pursue emergency nursing as a way to continue saving lives in a peaceful environment. Emergency room nursing had seemed perfect, using her medical training to help people without the tactical pressure that had defined her military service, working in a controlled hospital environment instead of combat zones, and providing healthcare that created healing rather than responding to violence. For 6 years, Sarah had convinced herself that her military tactical skills were unnecessary in civilian life, that her combat training had no place in peaceful hospital work, and that her role as an ER nurse was separate from her identity as a former pararescue operator. But some training never truly retires, especially when it involves protecting innocent lives from people who want to cause harm. The hospital shooting had created exactly the kind of tactical crisis that Sarah's Air Force pararescue training had prepared her to handle. Armed threats in confined spaces where civilian lives depended on someone with tactical skills and medical expertise. Sarah's story teaches us that military training creates lifelong protectors who carry their tactical and medical capabilities into civilian communities, ready to use their skills when emergencies threaten innocent people who have no defense against those who would harm them. 6 months after the incident, Sarah received an offer that would change her career path. The Detroit Police Department wanted her to join their tactical medical unit, using her pararescue background to provide medical support for SWAT operations and emergency response. Sergeant Johnson offered Police Chief Patricia Williams, "Your combination of tactical expertise and medical training makes you exactly what we need for high-risk emergency response." You could train our officers in tactical medicine while providing medical support for operations that require both combat skills and trauma care. Sarah's response reflected her evolution from combat rescue to civilian protection. Chief Williams, I'd be honored to serve. My Air Force training taught me that protecting people is a lifelong mission, whether they are wounded soldiers or civilians who need someone to stand between them and those who would harm them. Today, Sarah Johnson works as a tactical medic with Detroit Police Department's Special Response Team while continuing her emergency room nursing at St. Mary's Hospital. Her colleagues in both roles know about her Air Force pararescue background and appreciate having someone whose tactical and medical expertise provides capabilities that conventional emergency response cannot match. Sarah's story demonstrates that military service doesn't end with discharge. It evolves into civilian protection that utilizes combat-trained skills to defend communities when conventional emergency services are inadequate for the threats that they face. The emergency room nurse that used to be a pararescue jumper became the tactical medic who still saves lives when armed threats create medical emergencies that only military training can handle, proving that the commitment to saving lives transcends the uniform and continues wherever innocent people need protection. Make sure you're subscribed for more incredible stories of hidden heroes who use military training to protect civilian communities. American hospital patients and medical staff can receive care with confidence, knowing that warriors like Sarah Johnson have traded their military rescue equipment for nursing scrubs, but never surrendered their commitment to protecting innocent lives when violence threatens the healing environments where they now serve in peace.